The rotator cuff is a series of 4 tendons that wrap around the shoulder and the ball portion of the ball and socket joint. It provides this ability to elevate as well as rotate the shoulder, giving us strength in these motions. It can be injured traumatically or attritionally with wear and tear over time. And when this happens, you'll develop pain that radiates down the lateral aspect of the arm, particularly associated with nighttime pains. In order to restore function and remove pain, we do arthroscopic, minimally invasive surgery to bring the tendon back down onto the bone and restore the normal anatomy and regain strength and pain control. Management of rotator cuffs can be conservative or operative. We generally will try a non-operative approach first with physical therapy and anti-inflammatories. If this fails and functional deficits persist and the patient continues to have pain, we will then consider proceeding with an operative intervention to try to restore function and provide pain relief.